या दिवाली पे यूज करते हैं हम। Then next is PANTY. PANTY.
Good morning, sir.
Good morning. How are you, Swati?
I am good, sir. How are you?
Audio is clear, no? Audio video is clear? Video is clear? Audio and video is clear?
Yes, sir. I can hear you properly.
Yes, sir.
Okay. So who will be projecting that PPT?
Sir, one of our student is there. He will project the PPT.
Okay. How many participants?
250.
250. Wow. Very high number. Now, all of them, they're joining in Zoom.
Yes, sir.
This is
Something disturbance is there. I don't know. Who is talking?
The echoes is coming, sir, from my side.
No, you have to mute there everything. You have to, everyone's mic know how to mute. Otherwise, it's very difficult actually.
Yeah.
Lot of disturbance will be there. Except speaker, automatically you should mute. That control is there, no?
एक्चुअली 71 पार्टिसिपेंट ज्वाइन थे जैसे मैं 100 में देख रहे जीरो 100 में ये तरफ से मैं चालू कर दी नहीं मैंने कोई लाइव चालू कर એટલે કરી 100 માટે का वेट કરી 73 પાર્ટિસિપેન્ટ્સ તો થઈ ગયા થઈ જશે ફટાફટ નહીં લાગે તો 2 મિનિટમાં થાય ને તરત જ મને સ્ટાર્ટ કરી દઈએ હવે તો કરું છું થઈ ગયા છે મને મ્યુટ જ છે હા હા મ્યુટ જ છે હજુ સ્ટાર્ટ નથી કર્યું
Nikita? 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 Hello? Nikita?
Yes, ma'am.
निकिता अनम्यूट योरसेल्फ. जब तक स्टार्ट नहीं करते हैं आप आपस में बात कर रहे हो. पार्टिसिपेंट्स हैव टू बी जॉइंड.
Okay.
प्लीज. हाँ, अनम्यूट करो जब तक स्टार्ट नहीं करते.
Yes, ma'am.
Swati,
Yes, sir.
will it take some time?
Sir, only within few minutes we'll start. 99 participants are there. We are waiting for 100. Then we'll go live and then
Okay.
we'll start.
Okay.
Good morning, ma'am. Good morning, sir.
Good morning.
Sanjay, sir. Good morning. Varsha. Good morning. Vice principal and principal.
Shall I start, ma'am?
Yes.
Very good morning to everyone. I Nisha Taviar, first year MSc Nursing students from Pioneer Nursing College, Vadodara. It's a wonderful day and I feel privileged to extend my warm welcome to all present over here. It gives me a great pleasure to invite you all on behalf of Pioneer Nursing College. We are conducting webinar on challenges for researchers, identification of research problems during COVID-19. Before we start our webinar, I would like to give some instruction. If you have any questions during presentation, please give your comments into the chat box. If necessary, I will bring them up during the presentation or we will discuss at the end. To maintain the quality of sound functional during meeting,
I am not able to hear.
Sorry, sir. Some network issues are there.
Okay.
Just few minutes.
Okay.
sorry for the network issue. Let's start our webinar. Nandini Patel, for introductory speech. Over to you.
Good
Morning,
morning,
everyone.
everyone.
Thank you to
Thank you to
all
all
of
of
you
you
for
for
being
being
here
here
with
with
us
us
today.
today.
We
We
are
are
very
very
pleased
pleased
to be
to be
able
able
to
to
welcome
welcome
all the
all
speakers
speakers
and
and
participants.
participants.
I would
I
like
would
to
like to
invite
invite
our
our
principal,
principal,
Mr.
Mr.
Sanjay
Sanjay
Dixit,
Dixit,
and
and
Mrs.
Mrs.
Parsa
Parsa
Sarma,
Sarma,
Vice
Vice
Principal of
Principal of
Pioneer
Pioneer
Nursing
Nursing
College.
College.
Today we are
Today
going
we
to
are
talk
going to
about
talk
challenges
about
for
challenges
researcher
for researcher
identification of
identification
research
of
problem
research
during
problem
COVID-19.
during
I
COVID-19.
delivered this
I
lecture.
delivered this
We have
lecture.
highly
We have
educated
highly
and
educated
experienced
and
researcher
experienced
from
researcher
AIMS,
from
Mr.
AIMS,
Alan
Mr.
Anand
Alan
sir,
Anand sir,
and we have
and we have Mrs. Swati
from
Seth
our
from our
colleges.
colleges.
We have a
We
pre-webinar
have
test
a
and
pre-webinar
post-webinar
test
to
and
evaluate the current
post-webinar
knowledge
to
and knowledge
evaluate the
after
current
post-test.
knowledge after post-test. Thank you.
Thank you, ma'am. Before we start our webinar, I would like to share some highlights from our last webinar.
Pay you.
Sorry for some technical issue. We continue our next. Now I would like to start for pre-test. We share link for pre-test in chat box as well as in WhatsApp group. So I request to all of you to go through the chat box and give your response. Please submit your pre-test within a 10 minutes. Your time starts now. Pre-test link given in WhatsApp group and Zoom. So I request to all to go through and please submit your pre-test.
That's
8 minutes are over. 2 minutes are remaining. So hurry up. Now stop. Your time is over. Please submit your pre-test. I request to all please submit your pre-test. Now let's start session 1. So I would like to invite our first resource person, Mr. L. Anand. He is dynamic person with the positive attitude. He has completed MSc Nursing with the Medical Surgical Nursing. He has worked as a principal at various colleges. He has played important role in conducting workshops and seminars in Gujarat. He has he has guided so many postgraduate students of medical surgical nursing. Presently, he is working as a reader cum associate professor at AIMS Bhubaneswar. Over to you, sir.
Thank you, audience, and thank you, MSc Nursing student, and the principal of College of Nursing, and all faculty. Really, it's a good opportunity for me to share in this platform. Okay, so this is my campus. Actually, I am from AIMS Bhubaneswar. She introduced already. This is our beautiful campus. Next slide, please. Next slide. Can you hear me? Next slide, please. Or shall I change the slide? Okay. One of the main topic, actually, this topic is very much important to the current scenario because, see, you are sitting at home, some of them sitting at somewhere peripheries, and however, you have to complete your academic requirements by selecting some topics, and you have to complete your research requirement because no longer we can postpone. In this situation, it is very difficult to select a suitable topic, and there were a lot of challenges, and in fact, there were opportunities more than the challenges. Because this COVID-19 taught us there were a lot of things to learn, lot of things to understand. So you can see here, this is not COVID-19 is not something new to us. We have already had a experience in India. Can you see this image? There is, no, previous slide, please. Yeah. Can you see this image?
Yes, sir.
Yeah, you can see what is that something I put here, virus like that. Can you anybody recall it? Can anyone recall it? What is this picture all about? Can you recall it? No, actually, this is not something new to us. It's a Nipah virus. Okay, there is one movie taken in Kerala, released in Malayalam. Actually, this movie taught us there were many things to learn from the virus outbreak. It's a pandemic. Actually, this movie is all about. Already, they have portrayed how the virus infecting from one person to another. Even there were many nurses lost their lives. Particularly, one of the nurses who has written a letter to her husband before she died. This is something very sensible and very sensitive issue that has been created. How the virus and as a healthcare worker, we are at the very high risk. So, but unfortunately, we didn't learn a lot of lessons from the Nipah outbreak. So, in this situation, the COVID-19 novel coronavirus outbreak created a lot of challenges, especially to the healthcare worker, not only to the healthcare worker, even to the students. Because every day the students are confused on what topic I will take, or what type of research topic I will do. Because now situation is not as like before. Even the normal situation, the beginners always find difficult to find a suitable topic. Because what happens, no, sometimes they choose a topic, they go with some idea, they go with the teacher. What will happen? It is like it's totally the topic will be diluted. Somewhere it has been diluted, and ultimately they get some other topic which they are not interested. Even in the normal situation, I think hope you remember a story. It's a Shakespeare story. You remember that? Okay, in that actually Shakespeare is very much what to say that philanthropic mind, and he has nothing in his house. Okay, he has only very little amount of soup and eatables are there. But he used to be a good host. Whoever coming to his house, he used to give a lot of things to them. Okay, so what happened? Shakespeare's wife prepared soup. Okay, and as usual, one friend came to the Shakespeare's house. Shakespeare is calling from the hall to the wife, bring soup to my friend. He's my beloved friend. Like that. Then wife, because wife prepared only a cup of soup because they don't have like luxury of offering to many people. So she prepared only a cup of soup and she brought the soup and given to the friend. And the friend has taken nicely, oh, it's very good taste. Then he left. Like next friend came because he's a poet. No? Many people used to visit his house. So many friends keep on coming. He offered a soup. Then everyone gone. Then at last he ordered the wife in authoritative manner, bring soup for me now. Then wife brought one cup of water. Okay. Then he asked, where is the soup? So this is the water in the soup of the soup of the soup of the soup. So what does it mean? Whenever the student choose some topic, what will happen? No, ultimately it will become diluted, where they land up in a topic which they are all not at all interested and no longer to carry out the research. So this happened in a real scenario also, even in normal circumstances. But no doubt, this COVID-19 created a lot of challenges to all the students, not like usual. It is something unusual, unexpected circumstances. So in this context, it is imperative to learn how to choose a topic in this scenario. So I think hope my presentation would help you all. With this introduction, I'll start. Like most of us, we conduct research. There are two purposes. Mainly, to generate knowledge. Actually, what is this knowledge? Knowledge for the profession, knowledge for the practice, knowledge for the discipline, knowledge for the education. So the research is something, one of the method to generate knowledge, generate some ideas, so that other will utilize the knowledge for the betterment of the human and the social welfare. So epidemiology you cannot separate from the research, because epidemiology is to study about the population, where AP upon demos population and study, the epidemiology. So you cannot separate epidemiology and research, because epidemiology is a part of the research. So what we do in research actually, why do we conduct, sir? Why we have to conduct a research? Many students ask me, sir, it is something, it's waste. We are not. We are just undergraduate. We are just postgraduate. Why do we need to conduct research only for the mark purpose or not? No. Research is something, an attempt to what is known already, to learn what is known already, and to generate a body of knowledge by discovering of some new fact, some new learning or new relationship, so that how you generate that through the systematic scientific inquiry. What is scientific inquiry? You analyze through your senses. You analyze, you verify the fact. Okay. So, for example, there is one commercial nutritional drink. Clear? It states that whenever you have this drink, you will become taller, sharper, and what you say that you will become very smart also. So, how many of you have taking that drink? Only very few, because I know that. Even though the advertisement is very good, but everybody has started taking the drink. No, we are not taking that energy drink. Reason is that we don't trust the research, because there is, because we verify the fact. Okay, because we verify the fact. If had it been like that, for example, fair and lovely, if you apply, you become fair. That is the advertisement they recall. So do we have, everyone apply fair and lovely in our day-to-day life? No. If had it been the fair and lovely is effective, whole Indians will be like a US citizen and a UK citizen. Right. So we don't trust, because research is something very much systematic and scientific inquiry. Next slide, please. Okay, so I already stated the main purpose of research is knowledge. But research is not only the option we have. Sir, every time we go to conduct research only to generate a knowledge. No, there are many sources of knowledge. We have been following that. For example, first one is tradition. Okay, there are many things. It is rooted in our tradition. For example, hand washing. You take nowadays we talk about so much about hand washing, but the hand washing is rooted in our tradition. Hygiene rooted in our tradition. It is not based upon the research or something like that. So, because you see, whenever you go to the temple, we should take bath and we should maintain hygiene and go to the temple, be it a temple, church, or mosque. Why it has come like that? It's a tradition. Because by tradition they identify hygiene is very important in prevention of diseases. And you would have observed in the temple and all, when they offer some prasad or something like that, they put a water surrounding it, or they clean with water. The reason is it's nothing but it's a hygienic practices. So we follow there are many things by tradition. Even in nursing also, for example, bed making by using a envelope tucked in properly or positioned properly. These are all those things comes under the tradition based upon the research. Okay. Then there are customs and practices. There were every religion, every practices that gives enough knowledge. For example, now only the research says that if you use turmeric powder, it is antiseptic or antimicrobial, antiviral like that. But we started using this turmeric powder all years, 200 years, 300 years back also we started using the turmeric powder. So, we know that turmeric powder is very much effective. Haldi is very much effective in controlling all those diseases, and even the food poisoning also it controls. So there were many knowledges we acquired from customs and the practices. Then third one is authority. What is authority? Authority means whoever the senior, whoever the superior, whatever they say, we follow. We learn something from them. So those knowledge are also very much important, because they are experienced people. Okay, they are experienced people. Based upon the experience, the virtue of experience, virtue of the character, virtue of the living, whatever they say, it would be correct, and it is knowledge is very much immense. For example, I think everyone using a Google map, because it is not always correct. The Google maps are not always correct. Uh, Suppose you ask the experienced traveler or auto driver, auto rickshaw driver, you ask him how to go to this place. He will tell, don't believe the Google map and all. From here you go to Aju Achakadi, from Aju Acha you go to the Sumandip College, from Sumandip you go to that park. Like that, he will guide in a different direction. In fact, whatever the direction he guide, no, the roads will be good. There won't be any traffic. We reach faster also, safely also. But whereas if you rely on the technology and whatever based upon the research only, the Google Maps are made. But still, it is inferior to the experience. Then trial and error learning. There were many things we learned by trial and error. We don't know what exactly, but we acquire knowledge by trial and error. Okay. Then experience and problem solving. And when the year progresses, based upon our experience, we are able to solve the problem. That knowledge is very much immense. Okay. So one of the beautiful story I want to share. When I was a student, BS nursing student, I was working in a casualty. They brought a 40-year-old woman with a completely look like unconscious. She has nothing in her, no movement in her body. Nothing was there. Okay, and I was so scared because I'm the only person, I'm only one nursing officer, and one RMO was there. So I'm so scared. I'm searching for ambu bag, I'm searching for ET tube, everything I'm getting ready. Then our senior nurse came. She took some ether from her bottle and kept on her nose, and suddenly she became conscious. So then only I understand. See, what is the experience actually? Because she is not truly unconscious, hysteric problem. So she simply solved the problem. Even the RMO doctor is ordering for a endotracheal tube intubation, back and mask ventilation like that. Whereas a senior nurse, she understands what is the problem. It is not a truly unconsciousness, it's some psychiatric problem. She managed it. So from that scene, I understand. See, suddenly we should not act immediately. We should check the pulse. We should not go with the panic. We should not be panicked, and we should be calm. These things and all like that. So this type of knowledge is very much helpful. Then problem solving method. There are some systemic problem. You keep on doing it. You keep on facing the problem. You know how to solve the problem. Nowadays, you know everybody is attending a online class. Okay, so initially you may be attending. Oh, it's very much boring. How to get rid of the online class? So initial few classes you make your video on. Then you are attending rigorously. You are attending. Later on you come to know. Okay, video can be switched off so that it online will be on. We can sleep. So you overcome the problem based upon your keep on applying a problem solving skills. Then last is reports, some newspaper, some published reports, some abstracts, some research findings. Okay, day by day some findings. Based upon that, we get lot of reports and we acquire knowledge. You imagine or you think when the COVID-19 started, everybody say that okay, everybody say that it won't reach India and it is not possible and it's a summer climate, it won't spread that much. A lot of reports were there. But what happened ultimately? These reports are failed. So some kind of knowledges we acquire from reports. So the reports are not static. So it means the report one day they publish one thing, it will be absolute. It will be no longer practiced in the next day. So you should keep on update reports. The reports also will use some kind of knowledge. Then last one is logical reasoning. So we apply logic. Okay, we apply discipline research. Okay, what is logical reasoning? Suppose you imagine when I was I share my experience when I was in Baroda. I was standing on the railway track. One side is coming Rajdhani Express, and the other side is another express is coming. I think it's Mumbai Chhatrapati Express. So both the trains are coming the same track. So what I did, no, I just jump into the track and stop both the train with my hands. So you know that it is in the paper also. You believe it? You will not believe it. Because why you don't believe it? Sir, how? That you were stopped the two trains in the standing on that track. It is not at all possible. So that is called logical reasoning. You say it is illogical, it never happened. So what happened? Through your logic, you try to relate the things and you understand things and you generate the knowledge. Last one is disciplined research. The disciplined research is something very much systematic and scientific. What is scientific? Scientific means it's a verifiable facts. Science is something verifiable facts. That is one of the beauty of the science. Every fact is verifiable, so that it creates a lot of trust on the learner. So that's why researchers play a very important role in generating a knowledge compared to other, because other sources of knowledge there are some disadvantages and there's some shortcomings. Next slide. So basically the research is two types. One is basic research and applied research. Okay, basic research mainly to generate some theoretical construct to understand something. But applied research is what is helpful to solve your own problem. Okay, solve you identify certain problem which is practical in nature and it needs some intervention where the problem is remain as problem. Even though you have done lot of intervention, but the problem could not be solved. So in that situation you use here applied research. The applied research main purpose of conducting applied research is to solve the problem which is practical in nature or which is which require immediate solution. Then action research and operation research. Action research In your own institution, in your practice, in your area, you identify the problem to solve the problem. That is called action research. That it is not meant for everybody because the problem is very much unique to your institution. The problem may or may not present in the other institution, but you want to solve the problem. Okay, for example, you observe in your college there is a dustbin. Okay, but whereas when you walk into the college, you observe there were a lot of chocolate wrappers, biscuit wrappers, some fruity boxes everywhere scattered. Okay, so this is a problem unique to your college. So now you want to solve the problem. So what could be the better solution to make them a good habit, to inculcate a habit of discarding in the bin among the students. So if you conduct a research in order to make them create a habit formation among the students, it is called action research. Operational research means it is for the whole institution. You want to change certain system. For example, in the ICU, okay, one-to-one assignment is there. But how do we assign the patient to the nurses? Normally, randomly we assign. Okay, you see bed number 1 to 3, you see 4 to 5, you see 6 to 7. Instead of that, suppose who is very much experienced, if I assign the very complex patient to them, then the care will be better. Who is least experienced, I will assign the least dependent patient so that she also feel happy and she try to learn so many things and she will not be having a reality shock. For example, freshers, they assign a very complicated case, she not knowing at all. Yesterday, I got one new recruit, one nursing officer joined. She has assigned in a COVID ICU. She never worked in ICU. But first day she worked, second day she started coming with a lot of tears and coming to me, sir, how I work in the ICU? I never worked in the ICU. There were so many big machines. It's real reality shock. So what I thought, really we need some operational research actually in that situation, how to reduce the stress among the fresh graduate, how to make the fresh graduate more happy, more competent, and gradually they're done instead of throwing everything on one day. So if I conduct a research, it is called operational research. It is for the whole institution. The similar kind of problem may be in the other institution also. So this research will help. Third is qualitative and quantitative. Here, in qualitative means we live with the patient. We don't restrict the patient. We collect as much as more information. It's like a casual talk. It's like a casual interview without having any questionnaire in your hand. Okay, it's not like that you collect a practical examination. What happened during the practical examination? Whenever they assign the patient to you, you go with your notepad. What is your name? What is your age? What is your sex? You ask to the patient, right? Like repeatedly, whatever as per your format, you keep on. What problem you have? Do you have pain? Do you have like that? You keep on rush. It is a quantitative research because there you have the set of question in your hand and you ask. But in qualitative research, we don't have the set of questions, but we have only the idea. It is like a casual talk to the patient. Suppose we want to understand what is the problem of the nurses working in the COVID ICU. Simply you just asking there, do you have a problem? Do you have this? They will not answer, they will not open up. Instead of that, you also go to the COVID ICU, stay there, be friendship with them, make an environment very cool and friendly. Then gradually you start asking in a casual interaction. They will tell so many problems when they work in a whatever the problem they work in a facing when they work in a COVID ICU. So this is called qualitative research and quantitative research. Next slide, please. Next slide. Okay. So now coming to that point. So, sir, how to select a problem? How to select a problem? This is every student know, starting from third year, fourth year, MSc student, BSc student, they keep on asking, sir, please suggest. Even somebody from Delhi, they call me, sir, you are from New York, no, sir, you are from medical service, no, tell some topic, sir, because I am not able to do, I am not able to find a topic. I don't know what to do also because this situation common to every person. It's not like you only having a problem. Even the person who complete PhD, even the faculty who teach for more than 20 years, 30 years also, they also find problem in selecting or they also find selecting a researchable topic. Okay, so this if you understand this definition, it will be much better. Okay, what is research problem? Research problem is enigmatic. Enigmatic means something very tough and very problematic, and you are not able to solve. Perplexing, keep on challenging you, or troubling condition. So you recall your experience, you recall your situations. As a teacher, when I take some class, now some students always sleep in the class, right? So as a teacher, I always this question in my mind: what could help the teacher to make the student alert in the classroom? Okay, so this is a situation. Okay, this is very even though I do lot of activities, lot of things, but yes, some 5 to 10% of students, they are always tired, they always drowsy, and they are not attentive in the class. So this is a research problem. Okay, you go to the ward, and do you think that all the patients are happy in the ward? Because most of the students are not happy in the ward. Most of the patients are not happy in the ward. Even though you give the best care, even though you give them, you talk to them nicely, you give them, you attend them, but still they are not happy. So this is a problem. Why they are not happy? What is the problem to them? If you take about the students, you ask, do you happy about your nursing curricula? None of the students will say they are happy. Sir, what is this? Sir, this many assignments, this many seminar, this many see webinar, and one day they are asking me to attend the webinar from 8 o'clock to 5 o'clock, and my data become cut off. Every day I am recharging. Who will pay money? What college it is? When see these are all the problems. So some problems are always challenging. Some situations are always challenging. Some situations be a problem. Okay, and no, there won't be any answers to solve the problem. So this is the good situation to choose the topic. For example, whenever you are seeing certain conditions, certain characteristics, certain situation where you are not able to solve, where even though you have certain attempts, but still you cannot reach 100%. So that is a topic you have to choose. The main purpose of the research is to solve the problem. It's a very simple. Why do we choose a research? Why do we do a research? We do a research to solve the problem. Problems are everywhere. Okay, if you look at the problems would be enormous problem. If you go to the hospital, if you see one patient will give thousands of problems, which is very much uh, cannot be resolved. Sometimes some problems you cannot resolve. You cannot. Okay, then not only solving the problem, suppose you cannot solve the problem, what we do, we explore the problem. We try to we go deep into the problem, we explore the problem. That is also a research, because it's not necessary in one research you have to solve the situation, you have to address it. In one research you can explore the problem. For example, during our clinical practice, my MSc nursing student, she accidentally observed, okay, sir, because tube feeding, every patient is getting right tube feeding in the neurosurgical ICU, but she casually observed it is not being practiced properly, because it's not easy to feed the patient in the neurosurgical unit, because it's not like GI unit, it's not like a general surgery ward where even if you give little mistakes, there is no problem. But in neurosurgical ward, patients are unconscious, they have the swallowing, and they don't have the gag reflex. So feeding to the patient, it should be utmost safety. So she casually observed those safety practices are lacking. It's not like that 100% lacking, but what is very important, it's lacking. So she come and told the problem, sir, like this, it's lacking. Can we do some educational research on that? I said, first you understand the problem, where it is lacking, what factor causing it. So now she has chosen the topic. She's observing what all the problems are there, what all the problems are there. Okay, so now she's observing each and every practices, each and every steps, what they are doing, what are the small mistakes they are doing, what position they are doing, how much they are withdrawing. Okay, each and every step you see, the kind of output is what I expect, it will be very much enormous than conducting an intervention. Okay, it's not like that. Research is always doing some intervention, doing some experimental study. So research is, it's both. You have to solve a problem, at the same time you have to explore a problem. But unfortunately, many teachers always tell the student, no, you have to conduct experimental study. That is only a high quality study. It's nothing like that. Even a small descriptive study, even you study a questionnaire survey, if you generate the good information, it will be much better. And these steps or this problem, the definition is common to both qualitative as well as quantitative research. Next slide, please. Okay, sir. What are the sources? How do we get the problem? From where I will choose the topic? First of all, your experience. First, you recall from first year to fourth year, first year to third year. You can't forget certain patients in your life. When you would have given in it, when you would have had a good clinical posting, you can't forget certain teachers. You can't forget certain situations. You can't forget certain patients. Because you always think, see, I have changed the position of the patient every 2 hours, as teacher said, I have done good bed making, I have given a very good hygiene, but unfortunately patient developed pressure sore. So now what to do, what to say, why the patient developed pressure sore even then despite I am doing? Then next question you are asking, sir, why should I wear cap? Okay, why should I wear cap in the general ward when the doctors are coming with long hair and all, but you are only asking nursing students only to tie the hair. Why should I do it? You ask question yourself. Then next you are asking, why should we check fourth hourly temperature? Why not 2 hourly? Why not 6 hourly? Unfortunately, what happened? No, since it is fourth hourly, we have to check. In my practice, I observe only out of 20 patients, one or two patients they checked for thoroughly temperature. Rest of the patient they record it as if they checked it because they just ask the patient, "Do you have fever? Are you okay?" Then they check. Okay, for whether they check pulse, whether they check respiration. Sometimes they check pulse and respiration, but they don't check the temperature. But they simply record based upon the previous recording, normal or 98, some value they record. So you should ask, see, why we should do something wrong things when it is not required. You should ask question yourself. Why it's like that? Okay, then there were some situation where you have seen that orthopedic patient who is having a traction, he always complain like I have hip pain, I have back pain. You know that patient is restrained in the bed, but how you can reduce the back pain? Because you cannot ask the patient to walk, you cannot ask the patient to play, you cannot ask the patient to move so much. But the patient is having a back pain. How to solve? Can we give only tablet after tablet? No. So you ask a question, you recall your patients, you recall your experience. Sometimes not only leave about the hospital practice, you are going and observing on the road. Somebody had an accident. Okay, but whereas you observe, there are many people lifting the patient because they are, and you know that, and immediately they give water. Why this wrong practices? That means, do you think that means they don't have the proper knowledge how to handle the accident patient, how to handle the spinal cord injury patient? Why can't you conduct? Why can't you conduct some educational program for them? Wearing a helmet is compulsory, but how many of them they wear the helmet? Okay, then you are observing in the COVID-19, you are observing mask. Mask compliance is mandatory. But why they are not able to wear proper mask? Why they are not able, you are giving full PPE to the patient, full PPE to the healthcare worker, but still they become positive. What is the reason they become positive? You explore. So based upon your experience, you explore what is the problem, whether problem in the PPE, whether problem in wearing a PPE, donning a PPE, or working with the PPE, or in between the duty practices, whether they remove the mask, remove the goggle, remove the face shield. You question yourself. What is the reason for it? You ask all the questions, whatever you know. You recall each and every moment you ask questions. Now you are attending a webinar. How this webinar may be more technologically sound, better than this app? Is there any other app available? Or how we can make asynchronous manner, synchronized manner? How we can make good voice quality? How we can make good interaction? So you ask question yourself, you will get it. Then day-to-day practice, as I said already, day-to-day practice, you always look what is the patient. You have to observe the patient daily from head to foot. You have to observe a patient, his patient surrounding. Once you started observing, no, you will know so many things. For example, after a surgery, one gastrectomy surgery, patient have lot of yellow color fluid is coming out. It's a contained bile. Okay, bile will cause severe skin excoriation. So now a student asked me, sir, only bile only, no, what will happen? Then I didn't answer anything. Okay, let the bile go because it's not in your hand, it's a surgical problem. Let the bile leak in the skin. Then but I told the students, you have to observe the patient daily, what happens to the patient. Then she keep on observing a patient day by day, how much bile is coming out, what is the output, what happens to the skin. When the student started observing, she identified that his skin become like excoriation, fully damaged. The student come and told me, sir, see, sir, the total skin is damaged. What happened to the skin? How we are going to bring back the normal skin integrity? Yes, I told that. That is the reason I asked you to observe. So now you know what is the problem now. So now this is a kind of research what she has done. What she has done, she keep on recording the patient problem. So it will help somebody know, even she can advise to the junior. See, if the patient is having bile rush and it's called bile rush condition, it may come from gastrectomy surgery, it may cause skin excoriation. So before, whenever you see the first drop of bile rush also, immediately clean the skin with oil, apply some butter, apply some skin protector so that you can minimize the skin damage. That is the knowledge you will give to the others. So then this is a good topic for the research. Then literature. There were a lot of journals are publishing nowadays because of COVID. You are getting most of the journals are free. You get a lot of topics on that. One of the journal, I studied one of the journal article. It stated PP is not giving a protection. PP is not good enough to protect them from the COVID-19. Even simple N95 is enough. Full PP is not enough. Full PP is not required. So it's a new finding. Because unnecessarily what happened, if this finding comes, immediately it come to my knowledge. See how far, I thought that only PP will give utmost safety. But nowadays a recent finding is coming even on simple mask and level 2 PP is enough. Not like full PP is not required. Then these findings help us actually. Okay, now the questions in my mind. Okay, which one is effective now? Okay, simple N95 is effective or full PP is effective? So now this is a good topic for the research. Then social issues. There were a lot of debates are going on. And nowadays also you will get whether men can join in nursing or not. Okay, whether why the reservation should be for the men, why the reservation should be 80-20 reservation. There were a lot of social issues will come crop up. And one of the issues you read in the paper, because lack of evidence, the rape victim was acquitted. Then you ask your question, where is the problem? Because when you read the total case history, you identify they didn't collect a vaginal sample from the rape victim. That is very much crucial to prove in the court, like that who has committed the rape when the rape has occurred. But they have not collected a vaginal sample in the casualty when the victim reached the casualty. So now you understand. So that means nurses are not having enough knowledge regarding how to assist the forensic investigation. So how that is the reason the case has been. Otherwise, you would have somebody might have punished because of lack of evidence. Only he gone out. So this social issue will help you. Okay, so maybe nurses are lack of knowledge regarding the forensic nursing. They don't know how to collect sample to assist the police investigation. They don't know what is forensic nursing. Like that, there are many social issues. And another social issue you would have read in the newspaper channels and all. The nurses who has completed from COVID duty entering into the house, they are not allowed to enter into the house. They are asked them to leave separately because of the nurse, the infection will spread. So it's a burning issue. So this kind of problem will help you to choose the topic. Then TV debate, print, digital media, social media. There were a lot of informations are coming out. Every debate will give some information to you, especially healthcare debate. For example, tablets. There were a lot of tablets are it come out and they say some drug will be effective, this drug will be effective, and even Trump has ordered some of the drug. Okay, I don't want to mention the drug. Okay, so he ordered. I have taken the drug. I become all right. Now ask me a question whether the drug is really effective in preventing COVID or not. So you ask the question in your mind. In the digital media, you identified one of the YouTube clipping coming from SGBJ where the head nurse asking the doctor, quarreling with the doctor, okay, fighting with the doctor. You identified why there is, nurses are very soft in their nature, right? They don't get angry that easily. Why do they get angry? Why do they burn out? Why do they get stressed? So you identify there was stress among them. But what is the reason for the stress? It's a good researchable topic. Then policy, protocol, and research priorities of various organizations. So you can ask certain questions whether really this policy work, really this protocol work, really the protocol being followed. And some of the organizations they have research priority. For example, Indian Nursing Council in their website, in the PhD column, they put the research priority. What are the areas we really need good papers, good research. So that will help you to choose the problem. Next slide, please. Another thing is expert opinion. You know very well. Then you expert. I mean, what mistake we do? No, expert means we ask the teacher. Actually, it is wrong. Expert means you have to go to the clinical who work in the clinical area, considerable number of experience. She has lot of problems to express. You ask expert, you ask her, okay, what are the problems you are facing when you work? What kind of patients you are getting? Just a casual talk. What kind of patients you are getting? One of the very one accidental finding I identified. Even I myself had the experience in Orissa, in Gujarat. The which one way it is common because animal related accidents are very common. Animal related motorbike accident, animal related car accidents are very common. Even I myself experienced. So when I went to the casualty, first day, because I'm very much curious to know how many, because after a personal experience, so I want to know how many of them every day it's coming. To my surprise, every day 3 to 4 trauma cases are admitted in our casualty with animal related incidents. For example, because of cattle staying on the road, cattle suddenly come, dog suddenly passes, and their pattern of injury is totally different. Now it's not like a motor vehicle crash. The pattern of injury also a little bit different. Usually they have a different kind of pattern of injuries. So there is one research project is going on in our hospital. After we identified that, it is undertaken by our nursing tutor in collaboration with the casualty medical officer. They are just studying. Their research is only what are the pattern of injury, mechanism of injury related to animal related accidents and casualties. So simply they are studying. So this will help. Expert opinion will help. And when I talk to the expert, actually, when I experience some patients admitted in the ward, same patient, when he developed chest pain, he come to the hospital within half an hour. But whereas the same patient, when he developed one side weakness, he didn't come to the hospital on time. He came after 8 hours, even though his house is just 1 kilometer from the hospital. So it threw me the question. See, for heart attack, for just chest pain, they are reaching the hospital within half an hour. But whereas the stroke also equally important because he sometimes stroke will cause death, even permanent disability. Had it been he come within half an hour or 1 hour to the hospital, we could have saved him. We could have reduced his paralysis. We could have he become a normal. He could have led the normal quality of life. But unfortunately, he came late. So this point throw me the question. So what is the reason why people are giving least importance to the stroke, least importance to the neurological sign, whereas they give more importance to the cardiac problem because of the awareness. In every way, least importance to the stroke. So this give me a topic. This problem I identified. So in this area, I can do. Can you hear me? I think my connection become unstable. Okay. Can you hear me? Anyone to please respond?
Yes, sir.
Okay. Then this point give me a lot of questions in my mind. That's just a delay. So then I suggested one of the BS nursing student. You just identify the information on you just collect the information. Whoever my student working in a casualty nursing officer, I called her. I told whoever coming with a stroke, you just identify only 3 questions. What time they developed a symptom, what day they coming, what time the treatment started. So this help us to make some data. This help us to create some data. What is the average duration they are reaching the hospital? It is also a kind of research. You identify the problem. Then another problem also in our casualty identify the waiting time of the patient. So what happens? Whoever come to the casualty, the one of the common attitude of the patient is they will wait in the cinema hall for 1 hour. They will wait in the other area for 1 hour. But whenever they reach the hospital, they all become impatient, including nurses, including the doctor, when they become a patient. I don't know why. So we identified every patient they rush to the hospital, and everyone they have to be attended immediately. If there is a slight delay, also they become violent and they break the door, they cause destruction, all those things, and it will come in the media like that. But it's casualty is not the purpose. Casualty give care based upon the triage. Okay, who is very serious, they will attend first. Like that only they do a triaging. But this triaging concept, the general public will not understand because they are not aware about it. So how to minimize this, make them better understanding, how to minimize the triage timing. How quickly we can segregate, this is the main problem we have in our mind. So this is a good topic for the research. So what are all the ways we can reduce the time? What are the system wise we can make arrangement? So this, and even though the casualty people, they are not satisfied because they want within 1 minute treatment should be started. Is it possible for every person to start a treatment in 1 minute in the casualty? It is not possible. So this is a very important problem to make them understand. So sometimes we may keep some flashcards in the casualty. Sometimes we can keep some display board. What is the average waiting period for emergency case, non-emergency case, and sometimes we may display the protocol so that the public come to know. Okay, oh, I am not emergency. Let emergency people will take care. So he will cooperate. In fact, okay. So this small intervention may help. So you can test this intervention as part of the researches. Then journal clubs. You keep on critic the various journals. The design is not proper. And by one of the best beneficial in benefit in attending journal club is you come to know what are the errors the previous research has done, what are the shortcomings in the previous research, what is the recommendation they have given. Where suppose I publish a paper, there is an average duration takes for a person to admit for this casualty is 5 to 6 hours. Then immediately you have a question. So how we can reduce the hour? The questions start from there. So you can conduct a research how we can reduce the hour or how quickly we can transfer the patient from the home to the casualty. Then by attending conference also there were abstracts are presenting. They throw always conferences throw many questions. Even this webinar, every topic I have thrown many questions. This question, no, if added when you recorded, you can choose plenty of research topic. You can not only now you want to conduct, you can conduct even later period also. Because whatever I'm saying all from my practical experiences, so it really will help you to choose some topic or you can explore some topics further. Then external and internal framework. You keep on observe your society. You keep on observe your institution. You keep on evaluate your teachers. You keep on evaluate your teaching method of your college. You evaluate your clinical teaching. In fact, when last year, when one of our BSc nursing student, they proposed the topic, sir, you don't mind if we want to propose one topic. You tell me what is the topic. They said, sir, I want to, how much our students are satisfied with our clinical experiences and clinical teaching. Had it been the other institution, they may say, how you can, because we know, sometimes they will say clinical teaching is not proper, why should I come in? But we encourage the student, okay, you go and study. You go and study what is the clinical teaching? What is the problem in the clinical teaching? How many hours the clinical teachers are coming to the ward? How many classes they are taking? Whether you understood or not? What about if they only the descriptive study they conducted, only their clinical experience. They conducted a questionnaire survey among all the batches of the nursing students, even positive students, because positive students they will be very honest answers. So you know that there were a lot of information we got to improve ourselves and restructure ourselves. So this kind of research definitely will help. Then peer discussion. Whenever you discuss with your friends, no, you will get a lot of ideas. But whenever you discussion, you should not critique each other. Just casual discussion you do. Okay. In my previous institution, I just had a brainstorming session with my fourth year student. Tell me what problem you have faced like that. One student hesitantly stood actually. So she said, sir, one thing shall I tell you, don't mind. It is a major problem. Tell me what is the problem. Sir, like that, no. When you go to the biomedical, when you go to the ward, there are bins are there, so nobody is following proper biomedical practice. Even though we learn in the first year to fourth year, nurses also not following, doctors also not following, even we ourselves also not following. Sometimes the bins are so confusing, which one to drop where. Then I asked, this is a good area to choose. You need not to worry about, you observe them. Nobody will bother. See, as long as your purpose is clear, they say she wants to conduct a observation. She wants to observe each and every person how they discard. Then she will record it. Okay, so this is a very good topic. So by brainstorming, even though if had it been other people, they treat you how you can observe me as I am a teacher, you are a student only, how you can observe me. We may neglect it, but we should not critique in that situation. We should see what is the output. So when you choose like that, when you do a brainstorming, you will get plenty of topics. Then out of box thinking, a new dimension to the older problem. For example, dressing. We think about dressing. In 1999, okay, diabetic food dressing is very, very challenging. Now, even today also, if you do, how many of you have dressing for diabetic food? I don't know. It will be so smelly and lot of problems will be there and very difficult to solve. Even till today also, diabetic food dressing is so complicated. Okay, in 1999, his name is Amal Raj. Okay, he got an idea. He's a nursing, MSc nursing student. He had somewhere he read if we apply a local insulin, the tissue may heal faster like that. Somewhere some content he read. So he proposed a topic, local application of insulin on the wound dressing. He publishes topic also in the TNA. So for example, insulin we are seeing daily, but we never thought, okay, local insulin would help. So he started doing a research. How far the local insulin will help? Like that, he started doing a research on that. And you surprise the local application of insulin. Though it is not very much effective, but no, he got an idea. He created it. Now we know that okay, somehow it is beneficial. So whenever you see something, you have to think out of box thinking. Okay, sometimes, for example, HME filter change. HME filter, no HME filter. Suppose HME filter is not available. So what is to be done? Somehow we have to create it. Somehow we can't connect. So the nurse who solve the problem of it. Okay, and the ECG machine, one of the nursing person who contributed mobile ECG machine. Only 4,000 rupees. We can connect from your mobile, and wherever you know it is a tele-recording. So doctors can give advice. So these are all the small invention because you have to see the problem in a different angle, not like conventionally you do things. Next slide, please. What are the ways you have to identify? Once these are some suggested steps, it will help you for the beginners. And first, you don't go into the very small topic. First, your area of interest. Go from the broader area like your neuro, like cardio, like sir, I am going on rehabilitation, I am doing on some public health care, I am doing on diabetes, and like very broader area you go. Then gradually you narrow down your topic, and whatever topic come to your mind, one of the main first step, do not critique. You don't critique your own topic. And don't show your topic to others also. That's first thing you have to do. Even how stupid the topic, no problem. You generate, you write, you like it. I will tell you, everybody they are using one kind of chapel, PCR chapel for the diabetes mellitus. You know that how the chapel has been modulated, modified, invented. It is from the stupid idea. It is from the stupid idea. Everyone is using a iPhone now. The iPhone, the display, you know, that thin glass, actually it came from the stupid idea. Okay, if you go through that case history, you will identify it's very stupid. The person prepared a very thin glass. Those days when glasses are mota. He prepared a very thin glass and he don't know how to use it. But he created a thin glass and he has shown this thin glass to so many exhibitions. Nobody, wait, what is this thin glass? What is the purpose of this thin glass? Nobody is going to use. When the electronic like mobile phone, tablet, monitors are started coming, people now they use this thin glass what has been invented 35 years back. 35 years back, what he invented, now it is being useful. So no idea is very much stupid. Whatever idea you're getting, you start writing. And that chapel also, PCR chapel. So he cut some rubber sheet and used it like a diabetic chapel. And he feel very much comfortable, cushion. It's like a trial and error. Then he identifies more comfortable and reduces the pressure points also. So that become more commercial. Now everyone, earlier it was only 20 rupees the PCR. Nobody will buy the chapel also. Like they say it's a bathroom sleeper. But now you see the same chapel with the branding and all, it's sold for in the market 2,000 rupees. You imagine, so no idea is stupid. So don't critique your own idea and don't show your topic to anyone when you are a beginner. First, whatever you come to your mind, just start up, keep on listing one by one. Always keep on diary and started writing. Even how stupid it is, no, it doesn't matter. Even it is not researchable also, no problem. Even it is not nursing also, no problem. You started writing. Whatever come to your idea, it may be a problem, it may not be a problem. Just started writing. First list, then refine critics. You yourself don't critique your topic. Okay, what happened? No, that is a common mistake we do. When we get little bit experience, we ourselves started critiquing. Oh, this topic is not good. This topic cannot be performed. Oh, this topic, my teacher will say something. One of the students want to know, you know that She wants to conduct a study on menstrual pad. Okay, menstrual pad discard practices. Because when she stay in the hostel, she identified the menstrual pads are not discarded properly. They discarded somewhere like that. And this girl come into the topic. You know what is the response she got? Everybody criticizes. Hey, what is this topic? That you cannot do that. Who will answer the question like that? But after some time, people understand how important this topic. It's not about menstrual hygiene. It's about the public safety. Because no, even the body fluid, if she has some infection, if it is a body fluid, there is a high risk of hepatitis B, high risk of HIV, high risk of other bacterial infection to the others who handle, especially the person who handle it. So it should be discarded properly. Even the animals, when they have come in contact with the virus, so there were a lot of problems are there. She really thought of the topic, and she devised a new device. Okay, once it is put, automatically the box will close. Like that, she created. But still in under conceptual stage. But she had an idea. So you don't critique. Even the best ideas will come out of it. You see, after some years, pad drop box will be placed everywhere, the market, the tribe, and this pad drop, it will sterilize. It will like how you are dropping the sharp in your container. No? Same manner she is designing it, so that it will not infect others, and it will become it will shredded. The pad will be shredded, and it will be disinfected. So many things she thought. It came from a very simple, stupid idea where everyone criticized her. Okay. Then refine your topic. Once your topic is selected, then okay, somehow you got into the topic, then started refining it. One by one you have to refine. It's not like that. Same time you pull all the topic and refine the topic. You should not do that. Okay. Here also you should not do critique. Each topic you take, refine the topic. How narrow we can go, how specific we can go, what I can study in that. Because in one research study, you can't study everything. So you must refine what is very much to you. Then retain whatever you refine, rest of the thing do not discard, keep the notebook safely because it will help you for future research. Or if this topic is not visible, you can choose another topic. Then next is rearrange according to your priority. Once you refine, you might have refined so many topics from each broad area. Then you think, you recall which one is really you are interested, which one you have some experience, which one you want to do. And don't your interest is very important. Your enthusiasm is very important. If you lost interest and enthusiasm on your topic, and definitely I challenge you, you cannot complete or you cannot conduct a proper research. That is the reason the teachers always never interfere in the student selection of topic. Reason is that the topic, the fire should come from within you. So that only will burn everything. So it's not like suppose I may be interested in another area. I cannot force my student, you do in that area. Because she may not be interested, she may not have experience, she can't do that. So it will having a problem in completion. And once you lost enthusiasm, interest, no, your research end nowhere. Then next is relook the topic, your priority, how it is, then restate. Okay. Then you make this a proper problem statement or write a proper problem question. Then last one is evaluate. Evaluate, next slide please. So how to evaluate? So now you've selected some topic, then started evaluating. Number one is researchability. So researchability, whether the topic is researchable or not. Not all the topic is researchable. For example, you want to know whether nurses can stay in the moon or not in your topic. This is your topic. Is it researchable now in this situation? Whether God is there or not. You want to research. Can you research? You can't do that. So there are certain things, ethical issues, some moral issues. You can't do that. Okay, you can't directly, you cannot research it. Then ethics and logics, because there are certain things you cannot violate the ethics. Ethics means justice to everyone, benefit to everyone, or harm and benefit must be divided, and it should be beneficial to the nursing, significance to the nursing. If suppose the topic is not related to a discipline, then there is no point to conduct a research. It should somewhere it should help the human and the social welfare. It should not be merely a repeated research. Like already there were plenty of studies about self-care, plenty of studies about diabetes. So you need not to keep on doing the same thing again and again because it is not significant. Okay, it is no way because you are going to give the same result only again and time and again. You are going to give the same result only. So there is no point in conducting which already researched so much. Then moral issues. Certain moral issues, actually it's very difficult to whether I can join a union or not, whether nurses can join union or not, whether nurses need uniform or not. So these are all certain moral issues, which yes, it is researchable, but there are some kind of limitations are there. So that's why better avoid such situations. Then another important thing I forgot to tell you, whatever the controversial issues that must be researched first. Sir, 4th-hourly temperature is to be checked or 2-hourly temperature to be checked. There is nothing clear in the books. So this is a controversial issue. Sir, whether I have to use heparinase saline to flush the IV catheter or only normal saline to flush the IV catheter. Still it is controversial because still we need more research on that. Sir, when I will remove the IV cannula, whenever patient complain pain or whenever patient complain occlusion, we don't know when to remove the IV cannula. Sir, how many hours once I would remove the IV cannula? 72 hours or 96 hours? We don't know. We don't know what is exactly to be done. So there were a lot of controversial issues are there, challenging issues are there that should be taken. That is a very important topic should be taken for the research. But unfortunately, many teachers will tell, no, it is a controversy. Don't choose the topic. So first thing you should remember, controversy issues to be researched first, then only next priority. Okay, so that is my opinion and most of the experts' opinion also. Whatever controversy, that means whatever the knowledge, evidence you generate, no, it gives more knowledge. It will give you to explore further. Okay, so I have to give 30-degree bed elevation or 45-degree bed elevation. Still controversial. So you can do 30-degree one patient, one group of patients, 45-degree another group of patients. And you check vomiting sensation after feeding. You check regurgitation after feeding, right feeding, 35-degree and 40-degree, 90-degree for the head injury patient. So because you can study, there are so many things are controversial. Okay, then whether I have to give milk or not for certain diseases. So like that you can do, there are many situations are there. Okay, then feasibility. Once your topic is choosing, then you evaluate each topic. Time, whether you have sufficient time. Timing. Okay. For example, one student proposed the topic she wants to study quality of life among the asthmatic subject. Topic is very good, excellent topic because the asthmatic subjects, no, I know most of you may have the suffer from asthma. The studies say that 2 to 3% of nursing students suffer from asthma. So the asthma topic is very good, quality of life, because she suffers a lot. She herself is asthmatic subject, so she knows what are the problems the asthmatic subject face. So she wants to study quality of life of the asthmatic subjects. And I say the topic is good since you yourself are asthmatic subject, you have a better knowledge about it, you can study. But I asked a question, what is the timing you are going to conduct a study? She said, my data collection period from April to June. That means this study is not feasible. Even though the study is good, because April to June, you will not get that many asthmatic subject in the hospital. During the winter season only, always you get more subject. So it is not feasible. So the topic is good, it is not feasible. Then resources, whether proper lab facility available, according whatever the resources you require, like manpower, money, all those things are very important. And suppose you want to do the D-dimer test of the COVID positive patient who recovered from the hospital, or you want to know the health status of the nurses who become positive, discharged from the hospital, follow for 6 months. What is their health status? To conduct that, you need lot of resources. You have to do a lab test, you have to do X-ray, you have to do a CT scan for them. Then only you know what is their problem. And suppose you want to assess the infertility issues among the COVID-19 positive subjects. Okay, who are COVID-19, who is the eligible couple who become a COVID positive, and you want to follow them, whether they have problems in infertility or not, or you want to identify their menstrual problems or harmonic changes, hormonal profile. So you need lot of, topic is very good because none of them has researched so far this topic. Who is positive patient? You take the positive patient, positive women, you just do a hormonal study, you just do their quality of life, you understand the problem, you understand the menstrual changes before and after. It's a very good topic, but you don't have the resources. So you have to think of feasibility. Then availability of population and subject, whether they cooperate or not, whether they will cooperate or not. So one of the study we stopped actually, we started already, we stopped. because I want to know the COVID positive patients' lived experience. Whenever they were, whenever they suffer, whenever the nurses suffer from COVID positive, we want to stay in the work in the same ward. We want to observe them and we want to talk to them and we want to share her problem. We want to identify the problem. What are the problems and all she is facing, like loss of aphasia, sorry, loss of anorexia, tasteless, hearing problem, so much tension, fear, like that. Only we want to study, not like a questionnaire. We want to observe her like a casual talk and observation, like a participant observation. You know, when we designed the study, there were some few nurses who become positive, they stay in the ward. But later what happened? Whoever is positive, hospitalization is not mandatory. They discharge them, they only home isolation. Now home isolation, I cannot go and stay in their home and collect their data. Right? Is it possible? I can go to their home and stay and collect their data? Not possible. So we stop that research. So sometimes the topic is good, but over a period of time, it is not possible to conduct a study. Then expertise. Whether are you expert or do you, if you are expert, you can conduct. But ultimately, the students are not the expert. In any research, you are not expert. That's why we have the guide. Whether the guide is expertise in the area, if your guide is not expertise in the particular area, then you will be land up nowhere. So you should, the guide and student should have synchrony. Okay. So this topic, okay, I am confident. Some people simply they take qualitative study where the guide has never conducted any qualitative study. Even she is also new, student also new. The study will end up somewhere. So expertise is very important. I mean the guide expertise and the expertise in measuring something. Suppose you are studying a blood pressure. You are observing a blood pressure. If you are not expertise in recording a blood pressure by transducer method, then you should not conduct. Then even though study is good, it is not feasible. Next slide, please. Once all the problems are listed, then you choose a appropriate problem, you evaluate the problem and choose the appropriate problem. Then your problem is ready. So these are the important steps I have recalled. Okay, so I recall the important steps. Only thing is your experience. That's very important. Every day you recall your memory. Like Facebook, how it remind you every year what photo you uploaded, what photos you have. Like that you recall everyday experience in your clinical. Everyday problem you recall in the class. Everyday problem you recall in the society. What you observe in the society. Then you will get plenty of researchable problem and you will be expert really. The next is the important thing is what are the challenges? I said yes, there were a lot of challenges. Main thing is here we cannot go face-to-face contact because there were a lot of social restrictions and patient will not be cooperating. Sometimes you may get up, you may if you go, if I send the student for the data collection, she may become positive. So there were a lot of precautions also, risk also. That is one of the major challenge in conducting a study nowadays. How we can overcome that? We can conduct a telephonic interview. You can have a barrier technique. Okay, you can follow a distance data collection, or you can even distance even some Google Forms you can do. Okay, so there are many methods. You can use the technology for it. Then researchable problem and resources. Now, what is another issue is, sir, every topic is good, but now I can't do because all COVID patients are there, and I will not get the lab. Labs are closed. So you have to redesign your research. In that situation, you have to redesign your research, and you have to propose a new topic, redesign your research, and refine your topic. And it's nothing like that. Problem is not researchable. There were new problem you can take it. Suppose the old problem, what you have chosen, sir, OPDs are closed, patients will not come. Then you redefine your problem according to the predict how many days the OPD will be closed, how many days the COVID-19 patient will come. What is that projected structure? What is the projected prevalence of COVID-19? Then accordingly you choose. Then ethical issues and vulnerable population. Another major problem here, like everyone is forgetting, whoever the COVID-19 positive patients are vulnerable to, they have the special informed consent. Like how you collect data from the pregnant mother, how you data collect from the children, how you data collect from the geriatric, those, and how you data collect from the underprivileged society, tribal population. These are all highly vulnerable population, economically backward, highly vulnerable population. Why? The patient may participate in your study because by participating, you will give him a remdesivir and other tablet at free of cost. Otherwise, he has to buy. So that means indirectly you are forcing the patient to participate. So that should not be there. So vulnerable population, you should be very much careful. Sometimes they may become positive because of you. Okay, because you don't know, you are a asymptomatic carrier, but they turn out to be a positive. So who will pay for the treatment? So you should be very much careful whenever you are choosing. They are highly vulnerable and there is a higher chances for ethical principles violation. Then subject recruitment. That's also another challenge. Okay, suppose you say the true definition, if you are not clearing, whenever you are choosing some COVID-19 patient or related patient or other group, the definition must be very, very clear. Your recruitment criteria must be very, very clear. Okay, if the recruitment criteria is not clear, there is one of the very important challenges you will face because you want to do COVID-19 positive patient. So if you don't define properly, the person who become COVID-19 become 3 months before also will be your subject. The person become 1 week before COVID-19 also will be your subject. The COVID-19 who discharged from the hospital also will be your subject. But if you recruit all three subjects, if you compare, one is 3 months, one is 1 week, and one is 1 day. So definitely there will be inter-subject variability, and your research will be. We can't trust your research because there is a huge variation in your research. So there is a problem. And further, recruiting a COVID-19 subjects also problem because they are a positive patient. If you ask them to participate in your research, they are already depressed. Now people are happy. Now people are happy. Even they are not bothered whether they become positive or negative. But if you see in the month of March, April, May and all, when they become COVID-19, they really depress. I had a chance, but one of our nursing officers, and she became first case of COVID-19 positive. She is a nurse working in a hospital. She got admitted in the ward. They gave some tablet. For the doubt, she called me, sir, whether I can take this tablet or not. When she called, she started crying like anything. No, tears are coming. She's in a depressive mood, and she's like to attempt suicide. Then I made her to make a video call somehow. Okay, but that moment no very important. If had it been she didn't call, no, maybe she would have done something attempting suicide also because that much harassment she faced from the society, from the hospital, even our own hospital. She faced a kind of harassment, a kind of what do you say, isolation. This thing, even learned people, even from the doctor. You imagine, even from the doctor, even me, haven't touched her hand and checked the pulse. You imagine, she is the first case. So this is the problem. Even patient will already I'm depressed and you are coming and collecting data. So these are the very important things we should keep it in our mind. Then another situation, it is unprecedented situation now and a threatening situation. One day one side and another side suddenly coming peak, and that's the people perceptions regarding COVID also changing. The guidelines are changing. So it is very much difficult in that to do. Like and the situation also constrained. Like one person is going to the hotel, like how nowadays how the research project presentation will be, first proposal presentation for the topic, how it will be, nowadays a person going to the hotel who is having all the diseases and ordering a vegetable curry, sorry, ordering a some soup, imagine some of the soup. Okay, then he told the waiter, see, soup should not contain salt. He written, okay, no salt. Soup should not contain garlic. Soup should not contain onion. Soup should not contain dal. Soup should not contain corn flour. Soup should not contain sugar. Like that, he has to keep on ordering. And soup should not be hot also because I can't drink. I have water ulcer. Then the person gave a cup of water to him again. So nowadays, what happened? No, whenever you are going to the research proposal presentation, when the teachers will be telling, everyone will be telling the participant, hey, this topic cannot be researched, this topic cannot be researched, this topic cannot be researched. Ultimately, you land up in no topic. So that is a situation you are deeply constrained. But however, there were a lot of opportunities also there. I will be discussing. Next. Data quality also. See, even though you conduct, there are two kind of data collection. One is primary data and the secondary data. Primary data means we directly go talk to the patient or directly we interact with the patient, we respond and collect the data. That's called primary data collection. Secondary data means, since we cannot meet the patient, only we see the patient record and we collected data from the patient record. But because we cannot interact with the patient, what we are going to do, there is no other choice, means we will be referring the patient record, we will be referring the patient and we do a secondary analysis or secondary data. One of the main problem in the secondary data, one of our MS nursing students, she proposed a topic. Okay, she wants to identify the recording behavior of the nurses in the ICU. So what she's, because she changed the topic because of COVID situation. So now she is going to the MRD and she is collecting all the patient files and she took a sample and she is verifying each record, how much the data quality means comprehensiveness is there, clarity is there, like that some criteria she is recording. You know what problem she faced? Most of the records are incomplete. Most of the records are incomplete. If the incomplete record, how she is going to analyze the data quality? Okay, see, you may face this problem also. That is called selective deposit and selective survival. This is a major two error will occur in the secondary data. Selective deposit means every record will be one area, but you will not get the record. Then selective survival means even though you get a record, you find a record, but that out of the record, 10 record, only 1 or 2 you can include, rest 8 you have to discard. So there is a major problem in a data quality. That is a major challenge. Then response rate. Everybody, you know, in a day I am getting more than 50 to 60 questionnaires. And the students also getting many mails, questionnaire, no? Google form, you fill up this, you fill up that. How many of us we fill up? How many questions I fill up in a day? And they all fed up, especially those who become COVID-19 positive, discharged from the hospital. When they are working, they are always complaining. So every day, some or other student, some or other person, they are sending questionnaire to me, but I am not able to fill up. My child only filling all the questions. So this is called a problem with the response rate and the data quality. You can't believe that mail questionnaire that much, whether the particular person only fill the questionnaire or not. Then the implementation of the intervention protocol. Even questionnaire surveys would be difficult. You think about the implementation of intervention protocol. Okay, one of the that student, PG student, she wants to plan. Sorry, not PG student, BSc nursing student. They come, sir, after lockdown, every student weight increased. She measured the weight of every student who stayed at home, because everybody at home, no. She, by checking the health record, we already measured the weight of the student in the month of January. Then again she measured the weight of the student now. You know that there is a 5 to 10% increase of weight gain on the student. So now she wants to reduce their weight, bring back to the normal, because according to them. So now the student, what they plan now, they said, we want to do Zumba training program, we want to do some dance program. Can I do that? I said, you can carry on. I asked how you are going to do that. Sir, I'll call every subject, every student in the hall, I'll make them to dance with the social distancing. Even though you make social distancing, but still everybody in the one room, no? So there is a possibility of risk of COVID. Then you pick the solution and come. You know, the student come with innovative solution. There is one app where everyone video recording will be there, and everyone will be dancing, and one instruction will be given. The trainer will dance, and everybody, by seeing that everyone should dance. So they comes with some innovation. So implementation intervention protocol always challenging. But whenever your intervention protocol is already finalized, already approval has taken from the ethical committee, you should not change the protocol without their permission. So you have to take permission in that case. Otherwise, you have to modify your intervention protocol. Then threats to internal validity. Another problem is novelty effect. Initially, whenever we ask questions, regarding PPE, COVID-19 and all, many response I used to get. Immediately they will respond it. All subjects will participate. And we have started on yoga training program in the COVID ward in some other hospital. Okay, then not me, some other hospital yoga training program. Initial first 2 days of COVID positive, everybody doing yoga very effectively. But after some time, first day, second day, third day, fourth day, the effect is reduced. There nobody is practicing now. Like that. Whenever you started Zoom classes in the beginning, in the month of March, April, everyone is more interested, everybody keeping the camera on, everybody will be attending. But you imagine now, how many students are attending nowadays, like properly the Zoom classes or properly online classes? You fed up. You don't, you no longer you have the novelty effect, right? So that is also same. It may happen to the patients also. Then there were many concerns and belief. They have some myth regarding COVID-19 that also make a challenges. Then mental health issue is also another problem actually. Their mood, your mood, their mood. Nowadays everybody mood, no, without going out, not going for food, not going for puja outside, not going to the temple, not going to the church, and we all have some kind of constraint within the four walls. We also all our mood are affected. So in that situation, the data conducting research would be a greater challenge. Next please. But no doubt, it gave us a lot of opportunity. Nobody means no, you know that before COVID-19, even including myself, I never used any online platform. Be it is a webinar, be it is a Zoom, be it is a Google Meet, I haven't used it at all. Okay, but first time when I started using a Google Meet, I don't know how to use. So now what happened, because of the situation made, there was a lot of technology orientation. Even one of our teachers, he's developing a adherence adherence app for the psychiatric patients. To motivate them to follow medication adherence, he is developing an app with the Indian Institute of Technology. Had it been the COVID-19 is not there, what he would have done? He go and teach in the ward. Instead of that, he's developing an app. That app will give all the data, all the information to the patients. So technology orientation. Now lot of telemedicine conferences, telenursing conferences, and even CNE being conducted by telemedicine, and even we are able to reach even the periphery of the periphery. We are able to reach. That is the advantage. Then new knowledge exploration. Because COVID-19 gives us lot of knowledge, lot of experience. So I think after this COVID-19, if at all any virus, any pandemic, I think the entire world can manage it without any hiccups. Not like not like previous one. And issues of multi-dimension. There were a lot of issues which cropping up, and every issues give us some problem. Every issues gives us some problem for the research, and these issues are multi-dimensional. Earlier we focus only on one aspect or two aspects. Nowadays we are getting opportunity to focus one problem in multiple ways. Then emerging and re-emerging diseases. So now we started looking into, oh, now COVID-19 came. Next, what disease will come? Everybody, we are thinking what virus attack will come from the China. We should be prepared. Okay, how to even we heard about quarantine? Even general public never heard about the quarantine. But now we started learning about the quarantine, animal quarantine, plant quarantine, like that we started learning. So the emerging and re-emerging diseases pose a greater challenge to us, but it gives us opportunity to study about the diseases, even identifying a vaccine. That's a greater opportunity. Then focus of research on health protection. Earlier we focus more on disease related. Actually, we are most reluctant on health protection, like vaccination, like hygiene practices, like mask. You know, I worked in Meghalaya. In most of the Northeast students, they wear mask even in the general circumstances. So that's why the rate maybe they contributing to the lower rate there. COVID-19 is low. Even Southeast Asian countries, it's a routinely their habit is they wear mask. That's why Singapore, Malaysia, Thailand, Laos, these are all no. The COVID-19s are very less, even though there is a lot of floating population, because the mask behavior is very common to them. But we now only we started learning hygiene practices. We started following hand hygiene. We started using the mask. So these are all gives us lot of opportunities. Even the students are coming into the topic. Okay, what about the mask hygiene practices among the non-healthcare workers working in a healthcare institution? See, healthcare workers, they wear mask everything because they know. But whereas the non-healthcare worker, like who is a non-healthcare worker, like a clerk, storekeeper, who is supportive staff, those people they are not aware. Okay, they think that corona will not come. Their mask behavior is very poor. So now the one of the BSc nursing students, they have taken the topic. They are studying the mask compliance among the non-healthcare worker in the healthcare institution, because this non-healthcare worker also come in contact with the healthcare worker, because we live in the same campus. We have the nurse who is working in the ward and may go to the office for some leave or something like that. So thereby they are also at the risk. Nurse also at the risk. So for them, so this is a good opportunity for choosing so many topics. Then at last, it's explore the unexplored. There were many areas Now only we come to know, oh, these are the dark area we never explored. Even during my MSc, I proposed a topic on hand hygiene in the ICU. You know what the critic I got from my teacher? Yeah, what you are going to do? You are just going to observe how they are going to wash hands and you are going to record. That's all. No, you should do a research like that. They criticize me. But now you see, only on hand hygiene, there were millions of articles are publishing day by day. Correct, no? So it gives the opportunity by exploring the unexplored. Next slide, please. Next slide. Okay, another opportunity, I already said that designing and developing new methods of research, modern methods of research, new innovations in the research methods, then impact of, there will be, now only people are studying like, now we have another opportunity. Because keep on we attend webinar now. Keep on, now we are mostly technology oriented. So what is the impact of technology on health? The students coming and telling, sir, whole day I'm not able to attend a webinar. My back is paining, my neck is paining, and you are, there have a lot of problems. Even some students are telling, sir, I have urinary retention because of attending webinar for so many hours. They are not giving me a break. Okay, and my vision got damaged. And keep on, I'm using a mobile, there may be headache I'm getting. Okay, and I'm getting kind of disorientation and impact of technology on education, whether these webinars are really effective on the academic performance or not. These are there are topics, it gives us a lot of topics, whether this kind of technology help in our education or not. What is academic performance? What is the relationship between academic performance and the technology, what we are using now in the day-to-day experiences? Then you ask the patient, are they happy with the teleconferencing? If you ask the patient, they say, no, I am not happy. I am happy only if you touch my body and check the pulse. I am not happy. Because the teleconferencing, telemedicine and all, they are not happy. Only very few people are getting happy. And economics. The student is already first class, first slide also I told. Students are complaining. Sir, one day I attend a class, I have to recharge every day 1 GB, 2 GB because you are all using very high data consuming app. Then the student suggested me one more app actually, which is low data consuming. Okay, like load in the Google Meet, there are some options, low data consuming. If everybody put the video off, mic off, and they put, so there is, it consumes low data. She identifies that. So you have to study what is, we have to design some kind of apps where it should not consume lot of app, or without mobile connectivity, is there any technology available to attend the class? Okay, like that, and then we have to design. It gives an opportunity to search for a topic, identify the topic. Then next is image of nursing. You know, before COVID-19, when you say nurse, they say, oh, nurse is something like that. Oh, it's a third class profession. But after COVID-19, everybody is saying, you are God, and they are doing puja. In Gujarat only I have seen. In Baroda, a nurse who completed duty and come. All the people are standing on both the side of the road, and they are putting flowers on her. It was viral in the Facebook and everywhere. See, earlier the same nurse living in the same campus for many years, but none of them they bothered about her. You were not even given a cup of tea to her. But today her image has changed. So now you can explore. Now what is the whether is there any changes in the society image about the nursing? Whether after COVID-19 any nurses will join, whether the nurses admission will increase, whether many people will come to the nursing or not. So you can study. There's opportunity for us. Then you can study the social issues, social isolation among the co-workers also. You know there are 5 nurses. One nurse become positive, other 4 nurses. What is the social interaction? Now it is okay. Now people okay. When you become positive, okay. They say happily. They say they are putting Facebook status happily. I become Facebook. I become positive. Like Trump, who put on the Facebook happily he tweeted like I become COVID positive. Now I am immune like that. Okay. Nowadays the social image also changing. It's an opportunity for us. You can study what is the trend of social isolation from March to December. How they feel the social isolation among the general, how they feel. So you can study on that issues. What is the trends between March to December? Then professional opportunities also you are getting. See now in your one platform, you are attending so many webinars from the expert speakers all over India. But that's something we never thought of, never tried it. So this gives us opportunity, and even not for opportunity, also for the research. You can, from your table only, you can conduct a research. Next. Like this, other opportunities are there, like public health surveillance, field investigations. Now we are more trained in conducting field investigation, pandemic, and it will help us to study some analytical studies, evaluation of certain program, evaluation of the government program regarding vaccination or tablet or any health education program, linkages between COVID-19 and any other hormonal changes, I said already, and policy development. Okay, your whatever is the research you conduct, no, it will help us to develop some policy. Next. Next. And now, earlier, we never bother about assessing community health. Now we are more into the community health. Okay, community is only a subject, but we never bother. But nowadays we are taking the research. You have more opportunity to conduct research in your community, making individual decisions, completing the clinical. Even one patient, you follow the entire life, entire 1 year or 2 year, you follow them and identify what are the post effect of COVID-19. Now you are getting opportunity. You can conduct it. Then searching for the causes. Why the particular ICU only there were more COVID positive infection among the healthcare workers? Why not others? What is the reason? You explore the factor on that. Okay, then it helps in policy and planning. Next. Next slide, please. Okay, now I will leave some questions. Wait, previous slide, please. Okay, now I will leave these 3 images to you, to all the, you can take photo of these 3 images, and after the session you have to tell what is these 3 images all about. Okay, next slide. Next slide. Okay, all of you have taken pictures. Okay, now you tell me what is these three images. Previous slide. Yes. Have you seen this picture anywhere? Any one person can interact, no problem. Or you put it in the chat box. What is this image about? You can put it in the chat box. I will. No answers from anyone. Sleeping. What is these 3 images? Definitely it is not about corona. It is not corona or COVID-19. It is something else.
Sir, it is a map of Baroda street.
Baroda street. Baroda.
No, no, sir. Broad Street.
Broad street. Okay. What is that significance here? What is that? What is that? Something connected to that?
Sir, it is mostly like the water areas or the drainage pipes is shown here. So maybe it is related to some diseases related to water.
Okay, good. Then?
And also the last image was shown about cholera. So maybe it's that about.
Very good, very good. Actually, this is the image about cholera. Okay, it's one of the very world famous investigation. Okay, next slide. Okay, this is about the cholera. Okay, what happened actually? This is you can read in the far book more detail. How the community investigation they carry out. Okay, see simply he also the researcher he also may stay like that. Simply he need not worry about it. But what the physician, whoever come to the hospital from the everybody dying. Okay, and especially those who come from a particular places, everyone is dying. Okay, then he identify what is the problem. Only the particular places are dying. See, that is the way he selected a problem. He conducted a research that made him to discover that saved millions of lives. Otherwise, we would have died because of cholera. Okay, so how he carried out the investigation of cholera? A simple investigation, a simple observation. He thought out of box thinking. Even none thought it, because the same patients going everywhere, but no doctor thought it. But he is a person only he thought. Why every patient come from the particular area only died, and why so many death rate only into that area? Why not in other area like that? That question which arises in his mind changed the world. So that is the reason the research problem means the question which you ask, who knows, it may change the entire world. Okay, it may add the work. Don't worry about what topic, how stupid it is. But whatever the postings, because whenever he proposed the topic, no, everybody laugh at him actually. What is this? Why you bother about who died, who survived? But he undertook the investigation. Then he identified from why these people only died. Then he identified the water supply. What is the source of the water supply? From where they are taking? Why these people are not dying? Then he corrected the water supply and many people survived. So this is one of the cholera epidemic investigation, one of the world famous investigation. You will find more detail in your book. So that's why the research problem is you cannot search in the research on the vacuum. Research is something around you. You have to open your senses and pick up the topic. So next slide. So if you have any questions, also you can ask in my Facebook Messenger. Also you can mail me. The next. Okay, thank you so much. It is one of the wonderful occasion of Orissa. So I think 99% of participants from Gujarat only. So don't miss this place whenever you're coming to Bhubaneswar, whenever you're coming to Orissa. Do visit Ames. Do visit. There were so many beautiful places around Orissa. It is unexplored paradise. So thank you so much for giving this opportunity to the principal of Pioneer College, Swati, vice principal of Pioneer College, and MS student. My congratulations to you. You have taken a lot of pain in organizing this, and you become a role model to everyone. Thank you so much for patient listening. If any questions, I will take.
Sir, thank you, sir, for giving your valuable insight on this topic. We really gain knowledge regarding this topic. We are thankful to you for your valuable time as well as your presence. On behalf of Pioneer Nursing College, I would like to thank you for such a being wonderful speaker. Thank you so much, sir.
Okay, thank you. If there any questions, any question session is there?
No, sir, there is no question.
Okay. Thank you so much.
Thank you, sir.
Good morning, all of you. Myself, Kinjal Vasawa from Pioneer Nursing College, Vadodara. First year MSc Nursing student organized webinar on the topic of COVID-19 nursing education today and tomorrow. After the successfully completion of our first webinar, first of all, I would like to thank our Honorable Principal Sir, Vice Principal Ma'am, all the teachers, and I also would like to thank our speakers and all the participants for joining us. We got so many positive feedbacks regarding our webinar. So here I present some of the feedbacks. Now we are ready to introduce our second series of webinar on the topic of challenges of researcher during COVID-19. So we welcome to all the participants to join us. We also providing the certificate regarding our webinar at the end of the webinar.
Now move on to the next session. I would like to welcome our second resource person, Mrs. Swati Seth. She has qualified with Master in Medical Surgical Specialty. She is an assistant professor at Pioneer Nursing College, Vadodara. Over to you, ma'am.
Good morning, everyone. Thank you very much, sir, for sharing a wonderful knowledge It was very nice information along with the very good explanation with the suitable examples. We will remember it, sir. Okay, so coming to my topic, that is session 2. Okay, formulation and components of the research problem. Next slide, please. So many of the time we always, so many students came to me, ma'am, please help us to select the research problem. Okay, so so many confusions are there, so many problems are there whenever you wanted to find your formulate your research problem. Okay, so formulation simply means you will translate your selected research problem into a scientifically researchable question. Okay, so whenever you find the problem, as Anand sir said, how can you find your problems? You have the sources of your problems. Okay, so once you have done the brainstorming, once you have the practical experience, personal experience, you have come up with the problem. Whatever the problem you have stated, that you wanted to formulate as a research problem. Okay, so researchers should have the proper knowledge about the subjects. So the process of moving from problem selection to a problem formulation is a creative process. It involves both sharpening of the terms of concepts and narrowing the scope. Okay, so next slide, please. So this formulation of the research problem have a series of steps. Okay, so it will started with the selection of the research areas, reviewing the literature and theories, delimiting the research topic, evaluating the research problem, formulating final statement of research problem. Okay, so we'll start with the selection of research areas. Next slide, please. Okay, so this is the first step and this is the fundamental step of the research process. Okay, so generally what we need to do, we need to start with the broad general ideas and choose the topic. Okay, we should perform the brainstorming. Okay, and we should choose an area of interest. Okay, so where does the come from the where does it come broad topic? Okay, so it would come from the practical experiences, personal experiences, articles, previous studies, researchers exposure to the clinical areas, even social issues. This all the broad topic come. Okay, so as Anand sir said, we should always find the broad term. So we can also start broad means if you want to do a research in a medical surgical. So what would be your area of research? Cardiology, nephrology, neurology. Okay. So once you will select the broad term, okay, you will try to narrow it down. Okay. So here are some examples about the stigma among the mentally ill patients, body image concerns for obese adolescents, okay, and experiences of people with depression. Okay, so this all the examples stated. This is the broad term, stigma among mentally ill. Okay, so we don't know stigma means it is a general topic. Okay, so if we want to narrow it down, we should do further steps. Okay, next slide, please. Okay, so reviewing literature and theories. Okay, generally we are reviewing the literature to identify what is already known on the topic. Okay, so once we will refer the previous studies, we should find out what are the lacking, what are the lackings is there. We can also refine the results. Okay, we can also test the theories. We can develop the theories and we can again test that theories. We can also expand existing knowledge and we can also refer the articles. Okay, so this brief ROL help us researcher to identify whether the topic has been well researched or gather what is little known. Okay, next slide, please. Then we will move towards the delimiting the problem. So delimiting generally means we are trying to narrowing the research problem. Okay, so delimitations are the boundaries of the studies. So why we need to put up boundaries to the study. Next slide. Okay, if we want to do a research on a awareness regarding cervical cancer, okay, so यहाँ पे there are so many things come in the awareness. Okay, ki what are the signs and symptoms, how it should be prevented, what are the early signs. Okay, so यहाँ पे when once the researcher has the area of interest, okay, उसे we need to narrow it down. ठीक है, we can also identify the specific aspects of the topic. We can list out that aspects and we can find the working definitions. Here we have the example. If the interested area relates to stigma among mentally ill patients, begin by asking yourself the meaning of stigma. Are you interested in mentally ill patients? Okay, so we can consider the selected topic and begin to narrow it down by brainstorming. Okay, and some questions will lead the researchers while others not. Okay, so we can also delimit the research problem by, we can choose the variables. We can also define the geographical area. So यहाँ पे if we are stating that our study is limited to selected hospitals of the Baroda city, so here we are delimiting the area. We can also write the objectives. Okay, so next slide. So these are some phases of narrowing the research topic. Okay, so we'll take the old example only. Phase 1, why stigma is high among the mentally ill patients. What factors influence stigma among mentally ill? What impact the stigma has got on the process of recovery among mentally ill? And to what extent these factors can be controlled, and how effective are nursing interventions in reducing the stigma among mentally ill. So during this process, some questions will lead themselves to research while others may not. Okay, so we will rule out those questions which are not amenable to the research. Okay, so we can also discuss with the colleagues, we can take the advice from the superiors, and we can prioritize the questions and narrow down to the problem. Next slide, please. So, evaluating the research problem. Okay, so we will start the rank ordering. Okay, and we'll also evaluate the availability of the resources as time, cost, subject. Ethical consideration also we will see. Okay, we will also see whether the topic is significant to the nursing profession. We will also obtain the administrative support and peer support is there. Okay, we will also see the relationship between the variables. We will also look for the, if the theories are testable or not. We can also decide the place and time. We will also see if it is practical use, and we will see what kind of research design we'll use, whether it may be descriptive study or correlational study, comparative study, experimental study, pre-experimental study. That also we will decide. Next slide, please. Then formulating the final statement of the research problem. Okay, so after establishing the significance, researchability and feasibility, researcher finally formulate a final statement of research problem. Okay, so यहाँ पे this particular statement, it should be scientifically researchable question. Okay, so next slide, please. Okay, so we should form a research question. Okay, so this research question is a foundation of research process and it begins with a question. Next. So we could use two types of research questions in a nursing research. Okay, whether it may be declarative form or interrogative form. Declarative form, whenever we will use, we will state the all answers directly. Okay, we will state what kind of variables we are going to study, what will be the setting of the study, who will be the participants of the study. Okay, that we will directly state in the declarative form. But in interrogative form, we will ask question. Means we will use WH questions. What kind of factors influence the stigma among chronic mentally ill? What are the effects of stigma on process of recovery among mentally ill patients? And is nursing intervention effective in decreasing stigma among mentally ill patients? Okay, so this kind of statements we can use in a type of research question. Next. So here we have some statements. I have taken the statements from medical surgical nursing. Okay, so this particular statements, these all are the declarative statements. Okay, effectiveness of the selected relaxation techniques on physiological parameters of patients diagnosed with bronchial asthma in selected hospitals of Mehsana. Okay, so here this particular thing will help us to identify the variables. Okay, what kind of intervention we are doing, that also we will see in this kind of statement. And what will be the setting of the study. Okay, so setting will be hospitals of Mehsana, or your population will be patient diagnosed with the bronchial asthma. Okay, next. Okay, so moving to the components of research problem. Next. So in a quantitative study, validation problem statement comprises of two components. Okay, population of concern and variable to be studied. Okay, so we have the PICOT format, that is participants, intervention, comparator, outcome, and time frame. Next. Okay, so population. So yeah, we have the description of the population, which specific population we are interested in, what are the characteristics of the patient or population, and what is the condition or disease of interest. Okay, so here we have the example. If we are interested in a mentally ill population with stigma, we'll also interested in age and duration of illness and area of residence. Okay, then intervention. So what is the intervention? So this particular format we will use whenever we are doing interventional studies. Okay, empowered based nursing education to reduce the stigma. Then comparison group. What is the alternative to the intervention? Outcome of interest. What are the outcome measures? And time. What is the suitable follow-up time to assess the outcome? Next. So if we are doing non-experimental studies, okay, our research problem also has 6 components. Relevance of the study, title of the study, operational definition of the variables, objectives of the study, delimitations of the study, and scope and limitations of the study. Okay. Next. So we see what is the operational definition. Okay. So this is the definition of a variable in a specific way in which it is measured in the study. Okay. Then objectives of the study. So it is a clear, concise, declarative statement which provides direction to investigate the variables under study. Next. Delimitation, that already we have discussed. Delimitations are the narrowing or putting the boundaries for your research. Okay. So generally delimitations are in our control. Next. Limitations. These are the characteristics of design or methodology that impacted or influenced the interpretation of findings from the study. Okay, it generally put out the strengths and weakness of the research. Next. Okay, do you have any doubts?
Yes, ma'am. There is one question from Zoya Mek. How can we apply narrowing in the qualitative research studies, such as grounded theory?
Okay, so generally, whenever we are in what we do, whenever we are doing qualitative studies, okay, it is quite different. Generally, we have to take this specific topic in a qualitative research, and then we should go to the general. Okay, ulta hoga pura isme. Okay.
Thank you, ma'am.
Any other doubts? Yeah.
No, ma'am.
Okay, so if you don't have any kind of doubts, I request you to be environment friendly, plant more trees, save water, use mask, discard it properly, and go green before the green goes. Take care. Thank you. Next.
Thank you, ma'am. Thank you so much, ma'am, for your wholehearted support. Your speech is really valuable for us. On behalf of Pioneer Nursing College, I would like to thank you for your stimulating speech. Thank you so much, ma'am. Our session is over. Now I would like to invite our Vice Principal, Mrs. Varsha Sharma, for giving vote of thanks. Over to you, ma'am.
Good morning to all.
Good morning,
Good
ma'am.
morning, ma'am.
How are you?
Fine.
Very fine. Here I'm the Varsha Sharma, the vice principal, working at the Pioneer Nursing College. The very nice to see you after the very long period, Mr. Anand L. Sir. He is here, sir. Sir is here. Sir has to be joined here. Just continue.
Yes, sir. Yeah, he's in room only, ma'am.
Okay. Okay. The very second speaker is the Swati Shet is there. Very thankful to ma'am. Please giving your valuable time is there. Okay. And very thankful to all the participants over here. And very thankful to giving the more refers to the MSc nursing students in front of and the back front of the stage. And I hope to all the participants will give that type of efforts in the very next time, and will conduct very different type of educational webinars, educational activities will go on the online in the due to the COVID-19 also. And I hope so in the very next time, as all the teachers will be wish that we will meet physically and we will organize the next of conference, right? So with the continuation of that type of educational activities, we will join the physically also. So don't worry about that, because it's a very nice experience for us, right? And that topic is a very needed for us, because we are the PGs only. Because whenever we will meet our students now, so that they are telling that, ma'am, research is not. Most of students is what telling that, okay, ma'am, more study, more confusion, more study, more confusion. No, in the matter of the research is what, okay, always you will do the research, and every time you will be find the very new fact and the new knowledges. Okay, so research has to be the one of subject only in our nursing, and the all of not a nursing in the education. So we need to be the again read and read, right? Whenever you will be the read and read, you will become take the depth of knowledges and find the new fact on you. So all the best to all, and very thankful to all the faculties and the participants join over here. Thank you to all. Thank you, ma'am. Thank you, sir. Thank you all the MSc Nursing students.
Thank you,
Thank you
ma'am.
very much, ma'am.
Thank you so much, ma'am. Now, time for
Thank you very
post
much, ma'am.
test. Link is given in chat box or WhatsApp group. Please submit your post test within 10 minutes. Your time starts now. I request to all of you to go through the chat box and give your response. Please submit your post test within 10 minutes. 8 minutes over. Please submit your post test. Now stop. Your time is over. Please submit your post test. Our session is over. Thank you to everyone, to all participants and all teachers. Thank you so much. Now our webinar is over. Thank you to everyone. We will give you feedback form in our WhatsApp group. Please fill up this feedback form. Thank you to all. Please leave the Zoom. Session is over. Thank you to all.